Most people believe cavities are just bad luck. Bad teeth from your parents, bad genetics. Sugar gets you eventually. I used to believe that too, until I started counting. In 25 years of practice, I have seen patients in their 70s with original teeth and patients in their 30s with mouths full of fillings, and the genetics did not explain the difference. The diet did not fully explain it either. Something else was going on, and once I figured out what, I stopped looking at cavities the same way. So today I want to walk you through what 25 years and a stack of research actually show about how cavities form, how they don't have to, and how a tooth that's just barely starting to soften can, under the right conditions, heal itself before it ever needs a drill. By the end of this video, you're going to know exactly what cavities are, exactly why most people get them, and the 7 changes that most consistently prevent them in the patients of mine who have not had a new cavity in decades. And I'm Dr. Helen Bennett. 25 years in practice, the last 15 of those as a biomimetic and holistic dentist, which just means I focus on saving teeth instead of replacing them, and on understanding the mouth as part of the whole body. Before we get into this, do me a small favor, drop your city or state in the comments. I love seeing where you're watching from, and it helps me know who I'm talking to today. And one important thing, everything I share is educational. It is not a substitute for in-person dental care. Use it to walk into your next appointment with sharper questions and to make better decisions about what goes in your mouth between visits. Here's what's at stake when cavities get treated as inevitable. Sit with this for a moment. The story most of us were told at 6 years old goes like this. Sugar makes holes, brush twice a day, fluoride helps, and if you get a cavity, the dentist drills it out and fills it. End of story. The trouble with that story is that it leaves out the most important part. Once a tooth gets drilled, it is never whole again. The filling will need replacing. The replacement will be larger. Eventually, you will need a crown. Eventually, you may lose the tooth. The clinical downhill is real, and it usually started with one tiny cavity that did not have to happen. There is also a quieter cost. The bacteria that cause cavities don't just damage teeth. They live in the same neighborhood as the bacteria that drive gum disease and chronic mouth inflammation, has been linked in major journals to heart disease, stroke risk, blood sugar control, even brain health. Cavities are not just an isolated event in one tooth. They are a snapshot of a whole body chemistry that, if you know how to read it, you can change. Here's the truth. Most dentists won't sit down and tell you. Cavities are not inevitable. They are the result of a chemistry problem in your mouth, and chemistry problems can be corrected. And about halfway through, I'm going to share the one nightly habit that has done more to prevent cavities in my own patients than fluoride, sealants, and expensive electric toothbrushes combined. It costs nothing and takes 90 seconds. Stay with me. Let me back up because I want you to really see what a cavity is. A tooth is mostly mineral, calcium, phosphate, held in a crystal structure called hydroxyapatite. That structure is being broken down and rebuilt all day long. Every time you eat, the bacteria in your mouth ferment carbohydrates and produce acid, which dissolves a little of the mineral on your teeth. That's called demineralization. Then, between meals, your saliva, which carries calcium, phosphate, bicarbonate, and other minerals, washes the acid away and puts the mineral back. That's called remineralization. A healthy mouth does both, all day, every day, for a lifetime. A cavity happens when that balance tips. When demineralization happens more than remineralization, day after day, week after week, the surface of the tooth gets weaker until a hole opens up. That's it. That is the whole picture. And once you see it that way, you stop asking, how do I fight cavities? And start asking the right question. How do I keep the balance tipped toward remineralization? Let me walk you through the 7 things that, in my practice, do that most reliably. I'm going to count these for you. And the 7th one is the one almost no one is doing. Number 1, the frequency of eating, not the amount. This is the single most ignored fact in all of cavity prevention. It is not how much sugar you eat, it is how often. Every time you eat anything containing carbs, and that includes bread, crackers, fruit, granola, those little snacks at 3 in the afternoon, Your mouth drops into the demineralization zone for about 30 to 40 minutes. If you eat one big slice of cake and then nothing else for hours, your mouth has all afternoon to remineralize. If you sip a sweetened iced coffee for 2 hours at your desk, your mouth never leaves the demineralization zone all morning. The grazer is in worse shape than the dessert lover. Eat your meal, finish your coffee, then close the kitchen for 2 to 3 hours. That single change has done more for my patients' cavity rates than anything else on this list. Number 2, what you drink between meals. Water, plain, ideally with a little mineral content from a clean source, not flavored, not carbonated all day long, not sweetened with anything, including the natural-sounding sweeteners. The mouth needs a neutral, mineral-friendly environment to remineralize, and almost every other drink, coffee, tea, juice, kombucha, sparkling water with a splash of citrus, pushes the chemistry in the wrong direction for an hour. Drink whatever you want at meals. Between meals, drink water. Number 3, the minerals on your plate. Your teeth cannot remineralize from minerals that aren't in your bloodstream. Calcium, phosphate, magnesium, vitamin D, vitamin K2. These are the building blocks. Sardines, leafy greens, eggs, grass-fed dairy if you tolerate it, bone broth, fatty fish. Vitamin D in particular is wildly under-replaced in this country, and research suggests adequate vitamin D status is associated with significantly lower rates of cavities at every age. I'm not telling you to walk into a vitamin store and buy everything in sight. I'm telling you to have a real blood level conversation with your physician about vitamin D, and to make sure your plate includes the foods your teeth are actually made of. Number 4, the pH of your mouth in the morning. Now, and this matters. Let me say something that's going to surprise you. Your mouth is not the same pH all day long. It is most acidic right after you eat or drink anything and right when you wake up, when bacteria have had 8 hours to ferment whatever was left there. Brushing immediately after an acidic meal, citrus, wine, soda, vinegar dressing, actually does damage because you are scrubbing softened enamel. Wait 30 minutes. Rinse with plain water first, swish, spit, then brush. In the morning, drink a glass of water before anything else, then brush. That timing, small, free, and almost no one does it correctly, protects more enamel over a lifetime than any toothpaste on the market. Now here's the part that's going to surprise you. The brush itself matters less than people think. The angle, the softness of the bristles, the time spent, those matter. But there is no toothbrush, electric or manual, that outperforms simply being thorough at the gum line for 2 full minutes. If yours feels rough, it's too rough. Replace it. Number 5, saliva, the unsung hero. Saliva is your remineralization delivery system, and it shuts down at night and weakens with age and with many common medications. If your mouth is dry, if you wake up unable to speak, if you breathe through your mouth, if you take medications for blood pressure, allergies, depression, or sleep, your cavity risk is dramatically higher, and almost no one explains that to you. Sip water through the day. Chew xylitol gum after meals if you tolerate it. Xylitol is one of the few sweeteners that bacteria cannot ferment, and there is real research showing it reduces cavity-causing bacteria over time. Treat any sleep apnea or chronic mouth breathing seriously, not just for your heart, but for your teeth. Number 6, the fluoride conversation. Honestly, I know this is the part where some people will already be writing me a comment. Let me back up. There is a real, evidence-based case that topical fluoride, used in low concentrations, applied to the surface of the teeth, helps remineralize early lesions and harden enamel. There is also a real, evidence-based case that swallowing fluoride is a different conversation entirely, and one I will not have for you here because it is a personal decision involving your overall health. What I will tell you is this: there are alternatives that, in the research, are looking very promising. Hydroxyapatite toothpaste, which delivers the actual mineral your teeth are made of directly to the surface, has years of clinical data behind it now, particularly out of Japan. and many of my patients use it with results I can see on their charts. I am not naming brands. I am telling you the option exists, and to do your own homework and have an honest conversation with a dentist who will actually engage with the question rather than dismiss it. Number 7, the nightly habit I promised you after your last food or drink of the evening, and that should be at least 90 minutes before bed. You brush gently for 2 full minutes. You clean between every tooth slowly with floss or a water flosser, and then you rinse with warm salt water for 30 to 60 seconds. Then nothing. Nothing in your mouth for the rest of the night. No glass of milk in bed, no sneaky cookie, no sugar-free mint, nothing. That gives your mouth 8 to 9 hours of pure remineralization time when saliva is finally allowed to do its job. The patients of mine who have gone decades without a new cavity all do some version of this. It costs nothing. It takes 90 seconds. If this were my own mother sitting in that chair, here is what I would want her to hear. Cavities are a chemistry equation. You don't need to be afraid of every grain of sugar. You need to give your mouth more time and more raw material to repair than to break down. That's the whole game. Here's where the gap comes in. There are deeper interventions for early cavities, ozone disinfection, silver diamine fluoride for very specific cases, glass ionomer, minimally invasive restorations, true biomimetic restorations that preserve the rest of the tooth instead of grinding it down for a crown. Those require a trained biomimetic dentist. I won't walk you through home versions because the diagnostics matter, but you should know they exist, and you should never agree to a full crown for a small cavity without asking whether a partial coverage option exists. Let me tell you about a woman I'll call Janet. 59 school teacher, came to me with the kind of dental history that would have made another dentist sigh, fillings in nearly every back tooth, 2 crowns, and a pattern of new cavities every single year for 15 years straight. She told me she brushed twice a day, used fluoride toothpaste, and did everything right. When we actually mapped her habits, the pattern was right there. She drank a flavored carbonated water all day at her desk. She snacked on crackers and dried fruit between classes. She brushed within 5 minutes of finishing her morning coffee, and she had been mouth-breathing at night since a sinus surgery years before, which no one had connected to her teeth. We changed 3 things: water only between meals, brush after rinsing and waiting, treat the mouth breathing with her physician. We added the nighttime salt rinse and a hydroxyapatite paste. She has not had a new cavity in 4 years. Janet's story is not unusual. Janet's story is most stories. Here's what 25 years in practice have taught me. The mouth is not a battleground. It is a balance. Every single day, your teeth are being broken down and rebuilt, and you have far more control over which side wins than the dental industry has ever told you. The cavities you have been getting are not bad luck, and they are not bad genetics. They are the slow accumulation of a chemistry you can change starting tonight with no equipment, no prescription, and no expensive technology. The drill is the last step. The drill is what happens when the chemistry has been off for so long that the tooth has surrendered to it. Almost everything before the drill is in your hands. The frequency of your eating, the water in your bottle, the minerals on your plate, the timing of your brushing, the state of your mouth at night. Each of those is a small lever, and pulled together, those small levers move what the textbook used to call inevitable. You don't need permission to take this seriously. You need information, and now you have it. Let's pull this together. Cavities form when the chemistry of your mouth tips toward demineralization more than remineralization, day after day. To tip it back, you reduce how often you eat anything with carbs. You drink water between meals instead of anything sweetened or acidic. You put real minerals and real vitamin D on your plate. You wait 30 minutes after acidic foods before brushing. You protect your saliva flow with hydration, and by addressing mouth breathing, you have an honest fluoride and hydroxyapatite conversation with a dentist who will actually engage with it. And at night, every single night, you brush slowly, clean between every tooth, rinse with warm salt water, and put nothing else in your mouth until morning. Do those 7 things consistently for 90 days, and most people will see a meaningful change at the next dental checkup. Some will not need a single new filling for years. A few will need a real biomimetic conversation about restoring damage that is already done, and that is okay too. There are excellent conservative options now that there were not 20 years ago. You are not a passive patient. You are an active participant in your own care. The dentist holds the instruments, but you hold the choice. In the comments, tell me, how often do you eat between meals, and which of the 7 changes are you going to start tonight? I read them. If this helped, hit the like button, subscribe, and share it with someone over 50 who needs to hear it. Take care of your teeth. They're irreplaceable. I'll see you in the next one.